welcome to Riverside Talk. My name is Candace Cousins-Hopkins, and I am the Associate Director of External Affairs here at St. John's Riverside Hospital. We're so glad that you can join us today for this webinar, The War on Drugs Continues, What You Need to Know Now. After the presentation, we will open it up to all of you to ask questions to our speaker, and there is a Q&A bar on the right side of your screen that you will see. Before we get started, I just wanted to acknowledge our team for the work they do on our webinars. Our AVP of External Affairs, Denise Mananas, our Community Liaison, Nancy Anabi, and our Media Production Manager, Jason Latore. I would also like to acknowledge our community partners who have been with us from the start, Yonkers Neighborhood Naturally Occurring Retirement Community and the Yonkers Public Library. We also have some new partners that we would like to acknowledge: the Ashling Irish Community and Cultural Center, Department of Veterans Services of City of Yonkers, Ardsley Parks and Recreation, Ardsley Senior Center, Bronxville Community Center, City of Yonkers, Community Baptist Church, Hastings Community Center, Irvington Community Center, Westchester Jewish Community Services, and the Yonkers Pathways to Success. Now let's introduce our speaker, Dr. Stephanie Widmer. She graduated from medical school in 2016, and she is board certified in both emergency medicine and medical toxicology. She completed her residency and fellowship training at North Shore LIJ of Northwell Health. Dr. Widmer works full-time as attending physician at St. John's Riverside Hospital, where she is the director of medical toxicology and assistant program director of the hospital's emergency medicine residency program. Dr. Widmer is active in research and scholarly activity as the current chair of the IRB committee, and she is passionate about medical journalism and is an affiliate of ABC News Medical Unit. Dr. Widmer frequently appears as a medical expert on various media outlets. So we are so happy that she's here today. She, does this often, so we are lucky to have her here. Welcome, Dr. Widmer.
Hi, Candace. Thank you so much for having me. I'm so happy to be here.
Yes, we are very happy to have you here. And let's just jump right into it. Drugs obviously is such a broad topic, and there's a lot to discuss. But I was thinking maybe we would start with the opioid crisis, since it's such a, terrible epidemic that's going on in our country nationwide. But what have you found here in our own community, especially in the Yonkers, Westchester area? What are you seeing?
Sure. So, the opioid crisis, Yonkers has one of our region's highest rates of opioid overdose and overdose-related deaths. The opioid crisis really does hit close to home for many of us. In Yonkers, during the first 4 months of 2023 alone, there were 75 opioid overdose related deaths that were reported. And it's important to remember that these numbers, the reported numbers, are always, underestimated. It's happening a lot more frequently than gets reported. And Westchester County has the third highest rate of heroin overdose deaths and all opioid overdose related hospitalizations in the region outside of New York City. But it's just, they're really big numbers, and it really hits close to home for many of us. And, it's a huge problem that's going on in our area.
Yeah. And I think maybe we should go back a little bit. There are, obviously opioid and an opiate. Can you kind of let us know what the difference is between the two?
Sure. So they have similar effects on the body, but opiates are naturally occurring, they're plants. Examples are heroin, codeine, and morphine. The difference is that they're naturally occurring. Opioids are synthetic, man-made. Fentanyl is an example.
And so what makes opioids so addictive and dangerous to people who overuse them? Because obviously they are prescribed, but then, used in the wrong way.
Sure. Okay. So drug and alcohol addiction, it's a very complicated process. In general, it's very complex physiologically. Substances it's different for everyone, and each substance has different, or some are more addictive than others. But the process that happens in the body, it's very complicated. But these drugs, especially opioids, humans have endogenous like opioid receptors in their bodies that these drugs can bind to, and it creates a cascade of effects when drugs start to bind to these receptors. Endorphins are released. I'm sure people have heard about the reward chemical or the feel-good chemical dopamine. Dopamine's released, and these drugs make you feel good, and the body wants to chase after that reward. And after a few times of use or chronic use, there's like a neurophysiological cascade of events that happen, and people end up becoming mentally and physically dependent.
Yeah, yeah, I mean, opioids obviously is a big problem. What are some of the other drugs that people are using now? I know, especially parents are always like worried, what to look out for, the street drugs. What are you seeing? And are there, a lot of drug overdose related deaths happening? Especially during COVID, I think we saw a spike of usage. So what's going on right now?
So, I've looked at the numbers, and there's definitely just over the years been an increasing number of especially opioid overdose related deaths, and opioid addiction. The numbers just keep rising. And during COVID in particular, there's some evidence that, especially during that initial phase of the pandemic, there was a spike in use, and it makes sense. It makes just common sense, and it makes clinical sense because during that time people were locked up. Wellness and mental health was very poor. People did not have access to addiction services. There was just a lot going on, and it looked like at the time, and again, of course, these numbers are always underreported, but there appeared to be a spike in opioid use and drug use during that period in the pandemic. But chronically over time, each year these numbers seem to be getting worse, and opioid use and the crisis, the numbers are just, it's increasing. It really is a problem. It is increasing over time. But in the community, and again, it does hit close to home in Westchester and in Yonkers. People are using different types of opioids. There's heroin on the street. People are getting into fentanyl. There's cocaine, marijuana. It's there. We see it all come through our doors.
Right.
There's a lot of various street drugs out there, and it gets very complicated. And a lot of people are, what we call polysubstance users, which means they're using multiple different drugs, and they come in with complex clinical pictures, and they need specialized care. And it's very difficult.
Yeah, I heard recently about a new street drug, trank or xylazine. What is that? And what are the effects of that drug?
Right. So, interestingly, xylazine, or as you said, trank, it is like a livestock tranquilizer, a horse tranquilizer, and that's kind of where it gets its street name from. But it is in the same class as other drugs like clonidine, which some people may be familiar with, which is a blood pressure medication that's used by humans. So it's not too, it's related to a class of medications that humans do use, but it is a very, very strong livestock tranquilizer. It's often used as a cutting agent, which is basically, it's used to bulk up, people who sell and deal drugs, when they bulk up their stock, they're bulking up their heroin or their fentanyl, and it's found almost as a contaminant in these types of drugs. It can cause really bad skin sores and rashes because it's often people inject it, and at the injection site, you can get very bad skin sores and rashes have been reported with the xylazine or the trank. The issue is that it's extremely sedating, and it's often found with opiates like heroin and fentanyl, and those drugs are already sedating. So when you're mixing this new contaminant and this new street drug with an already sedating class of medication, it becomes a big problem trying to revive people who come in after overdose.
Yeah, that's what I was going to ask next. Like, how are first responders dealing with this? How are they able to bring them back? Do they have method?
So for us, and in the emergency department, and even first responders who are, out in the field, it's an issue because we don't always know what we're dealing with, right? So people come in sedated, people come in unresponsive, and you don't immediately know this is heroin versus fentanyl versus xylazine. There's no like rapid test to necessarily find this out immediately. And when somebody's unresponsive, you don't have time to, you have to act. You have to worry about saving the person. So unlike opioids and opiates, there's no reversal agent for xylazine. So really, your best bet is if you're worried that somebody you're with has maybe overdosed on xylazine, you get them to medical care immediately, because really the only thing we can do is support them through it. There's not a reversal agent like naloxone that you can use for that is used for heroin and fentanyl and things like that. Xylazine, it's getting them to medical care and hoping that we can support them through it.
Yeah, I was gonna ask next about a revival agent. There was, I guess, FDA approved a non-prescription nasal spray for emergency treatment of opioid overdose. I'm curious, like, who should get this? How do you use it? When do you use it? Just, obviously, like I said, it's over the counter now. So what should people do with this new?
Right. And this is like an absolutely wonderful thing that has happened. There are a couple different brands of the naloxone, which is, the revival antidote for opiates. And in the setting of an overdose, it can be administered. It saves lives. The fact that this is now over the counter and easily accessible for people is incredible. I actually walked into like my local CVS the other day, and it wasn't stocked yet, but it was slotted. So I guess they must be getting it in any day now, but it's there. I Googled it. And you could buy it online at some of these pharmacies, and you can order it to your house. But really, if you have a loved one or you have a friend, there's somebody in the home who struggles with opioid use disorder, or if you yourself struggle, this thing should be, it's like the EpiPen, for anaphylaxis.
Okay.
It's just something that the more of it readily available it is, the more lives can be saved. And I just think it's wonderful that the FDA approved this and now it's available over the counter. So
Yeah, and do they have? I guess they have directions, or someone explains how to use this.
Sure. So it's usually like a nasal spray. So it's actually pretty easy to use, but there's directions on the box, and anything you buy at the pharmacy, even if it's over the counter, you can approach the pharmacist and they'll explain to you how to use it,
And just going on a different thought, what are, our elected officials doing about the opioid crisis? Obviously, it's a big problem, hitting all communities, all people, all races, all, everyone. So what are elected officials doing on the federal level, on the state level, local level, to help people, cope with this?
Sure. So, I mean, one major thing that we just discussed was the approval of the reversal agent to be over the counter. That's a huge thing that just happened very recently. Thanks to the FDA, but there's always initiatives that are ongoing. There was something in place called the X waiver, which is basically like a required document certification that providers, doctors, NPs, physician assistants, needed to have in place in order to prescribe a medication, which I consider also to be it's not a reversal agent, but a life-saving medication used to treat opioid use disorder, buprenorphine, which is, very important in the treatment of opioid addiction. And the X waiver, it made it tough for providers to prescribe the medication, because unless you had the X waiver, you could not prescribe it. It was an 8-hour course that you had to find and do in order to get the X waiver. And it really limited, providers' abilities to get people this life-saving medication, which is, it's one of the main ways that we're we're treating opioid use disorder these days. So
Mhm.
that has been removed. It was removed at the end of the year, just last year in December. That's huge because now this drug can become more widely available. So there's always progress being made. And I mean, even at the state level, even at the county level, there's always grants that are going towards initiatives to combat opioid use disorder. It's very much on our radar, but it really needs to be all hands on deck and just increasing awareness about what a huge problem the opioid crisis and the impact that it has on our community and like the other communities around us. Really raising awareness is very, very important. Reducing stigma, for people who struggle with addiction is very, very important. But there's always ongoing initiatives, and we make progress, but it's still a big, big problem.
I want to switch gears a little bit and talk about cannabis, like K2 or synthetic cannabis. That's also, as you mentioned, like in Yonkers, in our communities, on the streets. What's the difference between like just regular marijuana and this synthetic, and how is it affecting people?
Sure. So K2, or Spice, as it's called sometimes, is like a brand or trade name for the many, many, many different types of synthetic cannabinoids that are out there. And when I say synthetic cannabinoids, I mean like they are man-made. Cannabis, it's a plant, it grows, it's naturally occurring. These cannabinoids, they're synthetic, they're man-made, and they are engineered to function like cannabis, like marijuana. That's not always the case. Sometimes they exhibit, and there's tons of them. It's a countless number because they can constantly be, the chemical structure can constantly be manipulated and re-engineered. But they may have very different effects or much more intense and stronger effects on the human body, and variable effects. It can cause violent behavior, and it can affect different organ systems. Some people come in and they're after, using these synthetic cannabinoids, and their blood pressure is incredibly low. It's possible to overdose on these medications. And I'm hesitant to really even call them medications, but it's prevalent. Technically, their chemical structure is legal because it's so hard to just keep up with, the exact chemical that it is, because it's not, so sometimes they get sold in bodegas and gas stations. It's just, they're easily accessible, which is concerning, but the effects are variable, and it's certainly possible to overdose on these drugs.
Yeah, I was reading a recent report about the legalization of marijuana, and how there was, an assumption that it was leading to traffic-related accidents. And this was in Canada. They were seeing more people coming into the ER that had, I guess, marijuana in the system. But what are you seeing? Because I think it was inconclusive. They're still, I guess, looking, at these studies and the data. But are you seeing, since you are an ER doctor, are you seeing increases in, marijuana, I guess, related visits or traffic related visits for people who have marijuana? What are you seeing?
So I'm sure we've seen the same studies. I saw the study out of Canada where it claims that there's been more cannabis-related traffic incidents, and it makes complete sense. When something becomes decriminalized, it becomes more widely available. It just becomes ubiquitous in the community. The access is much more unlimited, and it makes sense that there would be more, because people are probably using it more and have much more easy access to marijuana, that there probably are more, motor vehicle collisions in relation to cannabis use. What I am seeing in the emergency department, it's not always easy to tell. You have, I guess, legal diagnosis that happens at the scene, and then you have like your clinical diagnosis that happens in the
Yeah.
ER. Do I always know
Mhm.
if somebody's intoxicated by marijuana every single time? No, I would be lying if I said that I always knew. Do people
Mhm.
always present to the ER immediately after a motor vehicle collision? Sometimes they do, sometimes they don't. So if it's hours later, I would have no idea. Anecdotally, it's difficult to say. I would say there's probably been an uptick, just anecdotally, but it's difficult to say for sure. One thing I can say with absolute certainty that I
Mhm.
am seeing is pediatric exposures to
Oh.
cannabis, and it happens just since the decriminalization much more frequently than it was happening before. And it's, the packaging that some of these, um, you know, THC, which is the active chemical that's found in cannabis.
Yeah.
These THC gummies, candies, whatever, they're packaged in very appealing packaging that looks like candy, and kids are getting into it. It happens
Oh, okay.
so frequently, it's super concerning. But there's definitely been an uptick in it since decriminalization, and we see a lot of it. Actually, it's kind of alarming.
Yeah, the gummies. Yeah, I was gonna ask, is it more like smoke or is it
Yeah.
the actual? But the gummies, yeah, I can see how
For
kids
sure. And it's
just think
kids,
it's
they don't know the
right,
difference, and they're eating like very, very large amounts of this because they think it's
right,
candy.
right,
The good news is when they do come in, usually it's just watching them and they tend to do okay. But depending upon how much they take or they consume, a lot of the times the kids who come in, they can't speak for themselves, right? So
right.
we're doing all these tests and we're doing all these extensive workups trying to figure out what's going on with them.
Mhm.
And that's not without risk, so it's not a great situation. So, again, it is decriminalized and it is just more prevalent in the area, but you have to treat everything as if it's blood pressure medication. You lock it up, you put it,
Right.
keep it out of kids' reach. Like it's
Mhm.
just away and out of sight, because kids get into everything and they're getting
Yeah.
into these marijuana edibles, and we've definitely seen an uptick in that.
Okay. Thanks for that.
Mhm.
Yeah, what are if people are struggling with drug abuse issues or want to help family or friends with addiction, what resources are out there, especially in our community and even, online that people can access?
Sure. So, I mean, I want to say we have Park Care here, which is our behavioral health and addiction medicine center, and they're very active and they have a lot of different resources depending upon, whether you need detox, whether you need rehab, whether you want inpatient or outpatient. They have everything. We have the New Focus Clinic that focuses on outpatient treatment. Just a lot of really dedicated staff members who work there and want to help people. So Park Care, even, and if you don't know what you need, or if you're worried that somebody that is like really struggling or has maybe overdosed, you can always walk through the emergency department doors where, there for you with arms open 24/7. So you can walk in, we'll get you where you need to go, we'll get you the treatment you need to get. Just, the hospital in general. If you walk through the hospital doors here, like there's someone here who can help you at all times of the day. And that's just, I think, really important for people in our community to know. And really, we at Park Care, we have specialists, we have people who are really trained in this, in addiction medicine, and who understand. So I just think, us here at St. John's, like we're always here for the people in our community. So
Great. Great. And are there any online tools that people, just like general information that you would?
sure. I mean, you can even just type into Google, and there's services all over the place. But I really do recommend that people try to get plugged in somewhere in the community.
Right. Yeah.
And just to establish care, it's best, when it's somebody that and you can develop a relationship with.
Mhm.
But there are resources, all over. Sometimes it's tough picking one, and
Yeah.
if somebody can guide you through that, I think, that's probably ideal to feel, because everybody needs something different, you know, something that's tailored to them and something that works for them.
Right.
So there's lots of resources and lots of options out there, lots of different interventions.
Okay. Great. Well, I thank you for sharing knowledge on this like incredibly, difficult topic. It's so important that we talk about this, like you said. If I didn't see any questions come through, but if you have anything, you can always email us. We'll show you those email addresses at the end. Our virtual urgent care platform is available all the time if you're unable to visit the hospital. And we also have a physician referral line in English and Spanish now. And as I said, we have a general questions email that you can email if you have any questions about this webinar or anything about the hospital. Dr. Widmer, we are so grateful again that you're here with us. And this webinar will be up on our Facebook pages, our YouTube page, and please share it with your friends and family. And this is such important information. And if you need more, like I said, just email us, call us, and we're happy to help. Thank you, everyone, for joining us. Have a good day.